Okay, I do it first right here. It goes completely flat. And then if I go sideways. Hello.
He walks in. What does that tell you? I don't think I've ever seen him ever walk in, take a look, and just sigh as his first reaction. I've never seen you do that. Whoa. To see Paul react like that, knowing that he does the hardest nasal surgeries in the world, tells you something. Holly's case is truly something we've never seen before.
All right, so let's talk about this. Okay. Go like this for me. Okay, so there's a gap in your nasal bones right here. It's called an open roof deformity, and there's two ridges of bones. I take cartilage and I add this glue-like material, and I might be able to even just fill in that little gap. The middle third, we have to add cartilage again, called spreader grafts. The third part of this is going to be the tip. So you, from what it appears to me, don't have usable tip cartilage.
Okay.
I would have to cut out all your natural tip cartilage and take new cartilage and make you a tip.
Wow.
Here is my dilemma and one thing I'm worried about. He usually doesn't hear me say this. I'm worried about how your nose is going to turn out. The nasal skin is really, really, really thin.
He's going to add a lot of tissue, which, you know, he's packing the suitcase, right? Puts more pressure on the skin.
Yeah.
You know, you zip up the suitcase, except he's going to put stitches in it. You're at super high risk for a blood supply problem. Necrosis, skin death.
Michael, Dr. Nassif, nice to meet you.
Michael, Terry Dubrow.
Nice to meet
Pleasure.
you.
Hi, Kristen.
Kristen, nice to meet you.
I haven't had surgery in 15 years, so I'm ecstatic to see Dr. Dubrow and Dr. Nassif.
Can you start in the beginning with us?
About 3 years of age, I smacked my nose right here, caught the bridge of it on a bed with the actual bed frame.
Yeah.
Okay. It wasn't soft. And it cracked it after about 15 years of it just crooked. Before I moved off to college, I decided you could get it fixed. Then it became a party trick.
What became a party trick?
Okay, I do it first right here. It goes completely flat. And then if I go sideways.
I've seen noses like this before. It's called a saddle nose deformity, which is collapse of this part of the nasal dorsum right here. Now, how does this affect you?
To me, he's perfect on the inside, and I want him to match his outside. When I first saw him, I remember thinking, man, that guy is so cute. But I noticed something was going on with his nose. So to find out that he had actually had a surgery already, I was like, oh, so you broke it and then had a surgery and it still looks kind of funky? Like, maybe we should get that checked out. But I didn't want to say anything until, you know, I knew him a little better. We've been together going on 5 years now, and we're moving into, you know, that next stage in life, and, well, I'm hoping so. It's on my vision board, you know, little raise.
Yeah, I noticed that she was like this.
You know.
There's nothing else.
And to my family, like, poke fun at him a little bit.
It almost sounds like you do a little bit too, I have a feeling.
I definitely point it out, and he gets pretty frustrated with me.
God.
It's his parlor trick.
Do that, dude, and look how wide and fat it is. Go ahead and push it.
Yes,
Yeah.
exactly.
He's,
It's
by the
cute
way, he's
first
imitating
time.
his ex-wife, just so you know. With
So what you... So, you do that to him?
I do.
God, that's not that cool.
Yeah, it's
Thank
not
you.
the coolest of
Thank
me.
you.
I know.
Thank you, Kristen, for reminding me of why I'm single.
My biggest concern is he started having this yellow fluid come out of his nose. And I started researching it, and to me, it sounded like it's brain fluid. And for me, that's a major concern.
Yeah, brain fluid coming out of the nose in general is a major concern.
Hey, can I have that spiky one?
There you go.
There's no way that's gonna fit in his nose. Put your head back for me, all the way. Nope, I can't see in there, and nope, I can't see it there. Here we go. His nostrils are so small, and after what he's gone through with the MRSA, this is probably one of the worst results and complications that I've seen in my entire career. All right, so let's talk about your nose.
Yes. I feel like crying right now, but I'm trying to...
Okay, I need you to be strong.
I'm holding back not to cry.
Listen, the thing is,
Because I'm
Rodrigo,
actually very extremely worried. That's why I'm here.
the issue is that what we call the soft tissue envelope. That's the skin.
Right.
So by you having 3 surgeries in a period of 12 to 15 months, destroyed your tissue, the skin's no good.
My nose was perfect after this last rhinoplasty. And my friends, they never had any problem at all. and I was the unlucky one. So I keep asking myself now, why me?
Your nose on the inside, you have no airway, and it's short, so this is all scarred together. And now, since you just had surgery 3 months ago, it's going to scar down more. It's in a healing phase. If you try to insult your skin one more time now while it's healing,
Yes.
there's a high possibility that if you let one of these doctors touch your nose now, this will turn black and then die and fall off. So, welcome. You've had some functional surgery that's gone wrong.
Yes, but I had really bad allergies.
Nasal drip or what?
I had bad nasal drip, and they prescribed a bunch of different nasal sprays. I was using it like 5 times a day, at least 5 years.
Ooh.
It was bad.
When you use chronic nasal sprays, decongestants in the nose, the tissue, the turbinates and the septal mucosa shrink. But then you get this rebound effect when you stop using it and they get really swollen. Then you can't breathe. That means you get addicted to it. So what you have to do at that point is use it again. So it's a vicious cycle.
When I went and saw the ENT, he had weaned me off the nasal
very
decongestants. Yes, and I wanted to be able to breathe normally. I'm very active, so he suggested surgery.
So did the doctor say they were going to do septoplasty,
Septoplasty.
turbinoplasty?
I heard that one too. Yes.
So that's
Reasonable.
a functional surgery that doesn't change, usually, the outside appearance of the nose.
And I had no problem with the cosmetic side of it.
So what happened?
After 2 weeks, when all of the packing started coming out, he had me sit in a shower. I would blow it out gently. And it was kind of like black stuff just coming out of my nose. It just was not normal.
It's rare that a patient takes out their own packing.
Yeah.
That's what the doctor is there for. And in that 2-week period, your nose still looked the same, right?
It still looked the same.
Okay.
You know, I eventually went back in and told him, I was like, hey, like,
I can't breathe.
really not breathing. He suggested a revision. That's when I started to notice a lot of this was really not how it
caving in?
used to be. Yes.
So only after the second surgery,
Yes. So
your
there was
nose
a
started
difference.
looking different.
Yeah, the bump here was very visible.
And you still couldn't breathe now.
Still couldn't breathe. So I ended up going with a new doctor.
Was your breathing a little better after that surgery?
No, my breathing is still
Did your
awful.
nose change more cosmetically?
It just seemed to get a little funkier wave going on.
And that was your last surgery?
Yeah. After that third surgery, I fell into a little bit of depression. Just going on a date and eating in front of somebody, having to like breathe through my mouth. When food is falling out of my mouth on a first date, that does not go over well. And so I've lost my love life as well.
So the pressure's on us.
Pressure's on.
Why don't you tell us why you're here?
I noticed, that my nose was bigger than the average person's nose, so that I wanted to get my nose fixed. But after my first nose job, I still had the huge hump. And so I got my second nose job done, and I was happy. Fast forward 8 years, and I started noticing that my nose started changing. The tip of my nose kept looking rounder and rounder. And that's when I thought, something's not okay, especially once I felt the tip of my nose was hurting.
Just touching it like this?
It hurts, and it
Really?
makes my eyes water.
So I don't really like the sound of that. When I hear the history of a patient developing pain years after surgery, I'm thinking, is it an infection, some inflammatory process, or is it a tumor underneath the skin?
I was given a referral and sent to a doctor, and he says, I don't know what you do have. You might be a reportable case, young lady.
No one likes to hear, I don't know, or you may have a reportable case from a doctor, because it really potentially means you may have an undiagnosable or even untreatable condition.
He gave me a list of things that could possibly, be.
Did he say a vascular tumor? Did he scare you with something
yes,
horrible like that?
at that time is when I came up here and tried to get,
So this wasn't too long then?
3 weeks ago.
That must be kind of frightening.
I feel like I want to be okay. I have 3 daughters. The youngest is 7 months old, and I want to be healthy for them.
So obviously that's scary to anybody. Your nose just starts growing all of a sudden. It's not the most routine thing that we hear. So what's going to be very important is our physical examination. So let's go do that.
The thought of having a tumor on the tip of my nose, I don't want to have to think that.